The procedures of organ donation and procurement for transplantation involve multiple steps, from identifying potential donors to surgically removing and preserving the organs for transplantation. Below is a detailed overview of the processes. 1. Organ donation process. A. Identification of a potential donor. Living donor. A healthy individual voluntarily decides to donate an organ, e.g., a kidney or part of their liver, to someone in need. The process involves a thorough medical evaluation to ensure compatibility and safety. Deceased donor. Organs are donated after the donor has been declared brain dead or after circulatory death. Brain death is irreversible, and organ donation occurs only with the consent of the donor's family or prior donor registration. B. Medical assessment. A series of medical evaluations determine the donor's suitability, including blood type and tissue compatibility testing, screening for infectious diseases, e.g., HIV, hepatitis, imaging and diagnostic tests to assess the health of the organs. C. Obtaining consent. For living donors, consent must be voluntary and fully informed. For deceased donors, consent is obtained from the donor's family unless the donor was previously registered in an organ donation registry. 2. Organ procurement process. Notification to an organ procurement organization, OPO. Once a donor is identified, the hospital contacts the local OPO to coordinate the process. The OPO works with transplant centers to match donated organs with recipients on the transplant waiting list. B. Maintaining donor viability. For deceased donors, the medical team ensures that the donor's organs remain viable until procurement. This involves maintaining oxygenation and blood circulation, administering medications to stabilize vital signs. Organ matching and allocation. The OPO uses the National Transplant Database to match organs with recipients based on medical urgency, blood type, tissue compatibility, and size match, geographic proximity to minimize ischemic time an organ remains outside the body. D. Organ recovery surgery. A specialized surgical team removes the organs in a sterile operating room. Organs are removed systematically to minimize damage and contamination. Key organs include heart, lungs, liver, kidneys, pancreas, intestines. Corneas, skin, and tissues like bones may also be recovered for transplantation. Recovery must occur quickly to preserve organ function. 3. Organ preservation and transportation. Preservation. After removal, organs are placed in sterile, cold storage solutions, e.g., University of Wisconsin solution, to slow cellular metabolism and prevent damage. Transportation. Organs are transported to the recipient's transplant center using specialized containers, often with tracking to ensure timely delivery. 4. Transplant surgery. The recipient undergoes surgery to receive the donated organ. Surgeons connect blood vessels and other necessary structures to restore function. Post-transplant care includes immunosuppressive medications to prevent rejection. Ethical and legal considerations. Regulations and oversight. Most countries have laws governing organ donation and procurement, ensuring ethical practices and preventing organ trafficking. Donor registries. Many countries maintain voluntary donor registries to streamline the consent process. Transparency. Allocation of organs is guided by strict protocols to ensure fairness and equity. Organ donation and procurement are highly coordinated processes involving healthcare professionals, regulatory agencies, and families. They aim to maximize the number of lives saved while respecting the dignity and rights of donors.